How does colchicine relieving gout pain during a flare-up? Imagine suddenly feeling a sharp, intense pain in your joint, accompanied by swelling, redness, and warmth. That's what a gout flare-up can feel like, caused by tiny uric acid crystals forming in the joint. These crystals are foreign to the body, so your immune system reacts aggressively, sending white blood cells to fight what it perceives as an invader. This immune response is what causes the pain, swelling, and heat associated with gout attacks. Colchicine is a medication that helps calm this immune response. It doesn't lower uric acid levels or dissolve the crystals directly. Instead, it targets the inflammation that the crystals trigger. When uric acid crystals appear, they activate immune cells called neutrophils, which rush to the joint and releases chemicals that cause pain and swelling. Colchicine works by interfering with the activity of these neutrophils. Specifically, colchicine binds to a protein called tubulin inside the neutrophils. Tubulin is essential for forming microtubules, which are like tiny scaffolding structures that help cells move and organize internally. When colchicine binds to tubulin, it prevents the formation of these microtubules. Without them, neutrophils cannot migrate efficiently to the site of inflammation or releases inflammatory signals. This action reduces the number of neutrophils reaching the joint, which means less inflammation and less pain. It also blocks the activation of a complex inside immune cells called the inflammasome. The inflammasome releases a powerful inflammatory molecule called interleukin-1 beta, which amplifies the pain and swelling. By inhibiting this process, colchicine helps dampen the entire inflammatory response. Additionally, colchicine decreases the production of other inflammatory substances like cytokines and leukotrienes, further reducing pain and swelling. Because it limits the immune response, colchicine also helps prevent additional tissue damage in the joint during a flare-up. Colchicine is most effective when taken early, right at the first signs of a gout attack. It can be used in two ways. Either as a preventive measure taken regularly at a low dose to reduce future flare-ups, or as a treatment taken at a higher dose during a flare to lessen its severity and duration. However, it's important to remember that colchicine is not a painkiller for other types of pain, and it must be used carefully because of potential side effects. Common side effects include nausea, vomiting, and diarrhea, especially if taken in higher doses. Serious side effects are rare but can occur, particularly in people with kidney or liver issues or those taking certain medications. Because of these risks, colchicine should always be used under the supervision of a healthcare professional who can determine the right dose and monitor for side effects. From the perspective of someone experiencing gout, colchicine offers a way to quickly ease the pain and swelling by calming the immune system's overreaction. It is a well-established treatment supported by health authorities worldwide. Still, managing gout effectively involves more than just treating flare-ups. Long-term management includes medications to lower uric acid levels, lifestyle changes, and regular medical checkups. In summary, colchicine relieves gout pain during a flare-up by blocking key steps in the immune response triggered by uric acid crystals. It prevents neutrophils from migrating to the joint and reduces the releases of inflammatory chemicals, helping to calm the inflammation and ease pain. While highly effective for many, it must be used with care and professional guidance to ensure safety and maximum benefit. Always consult your healthcare provider for personalized advice and treatment options.